Thank you, Rich.
Thanks, Rich. Well, where are we on the cost with this health care bill? The CBO says the House plan could cost more than $1 trillion over 10 years.
Here with the latest congressional reaction, we have Republican Representative Marsha Blackburn of Tennessee and Democrat David Scott of Georgia. Welcome to both of you. I will start with Representative Scott first because there are questions about the numbers. Nancy Pelosi's bill says $800 billion or so, and then we have the CBO saying a bit more. And then you have the Republicans saying more than $1 trillion. Which is it? Have you read it and do you know?
Yeah, I think it's going to come right down to right around $900 billion. That's pretty much where we feel it will be. It will certainly be below the $1 trillion mark, but right around $900 billion.
Now, I got to stick with you for a second. Doesn't that concern you, and particularly your constituents who are very concerned about the growth of the deficit?
Absolutely, but it's also very important that this bill will wrap off about $107 billion of that deficit. So health care is a very important tool to arrest the deficit. You're absolutely correct. We're concerned about this deficit, but as I said, $107 billion will be wiped away against the deficit if we pass this bill.
Representative Blackburn, I would imagine that you've crunched the numbers as well. Tell me what you see.
Yes, we have crunched the numbers, and this is what we are seeing specifically. It is not going to end up reducing the deficit. Their initial estimates, I mean, look at what Medicare was supposed to cost and what it's ended up costing. Look at what TennCare was supposed to cost when they implemented the test case for public option health care in Tennessee. $2 billion a few years later, it hit quadruple. And look at how they are doing this budget gimmick, Liz. What they're going to do is increase Medicaid, increase that program to 150% of poverty, and then they're passing that cost to the states. Tennessee estimates that their cost is going to be nearly $800 million per year, and you say that times 10 to look at what this bill would end up and how that transfer is going to take place. So our state and our local governments are going to pay, our individuals are going to see higher income tax rates, higher sales tax rates at the state and local level. And CBO says even that your insurance rates are going to go up with this bill. So you know the taxpayer's going to be hit from all sides on
Congressman
this.
Scott, we've been looking through the Joint Committee on Taxation analysis of what taxes will go up. One of the things is they're going to limit flexible spending by 50%. They're going to cut it in half to get $14 billion over 10 years. Are you comfortable with cutting flexible spending, a very popular program, in half?
Well, I think you have to realize that a lot of these items are on the table for discussion. We're going to go into a conference committee on this bill, where I believe, and I have said all along, that the cleanest way of doing this would be to get the savings out of the system, which could be about half the cost, and to put the surtax on at the top levels of about 1.5% of individual wage earners or salary people with salaries and incomes of $500,000.
Flexible spending is a middle class break, sir. It's not a high income.
Well,
that's exactly why I am not to that point yet, nor am I to the point of the tax on the so-called excise tax that's on some of these so-called more expensive packages. Because you got to realize the problem with the health care is the pricing, but it's the pricing that affects the middle class. So I, for one, am looking at a very jaundiced eye of making sure that none of these, but that none of these taxes affect the middle class.
Okay. Representative
so I think
Blackburn,
what you have here.
Hold on, let me jump in. Representative Blackburn, you know, you look at some of the reports that say, forget the government plan. Even without that, insurance companies are going to raise premiums for small businesses 15% next year. So doesn't something need to be done? And if you bring in the government with a pretty cheaper plan, for example, doesn't that then force private insurers to get more in step with the middle and lower class of this nation to make things more affordable?
Actually, what happens is the exact opposite. When you have a public option plan in competition with private insurance, it drives the cost of private insurance up because of cost shifting that takes place in your hospitals and with your providers. Now, there are plenty of ways to address this without implementing a payroll tax, a wheelchair tax, a small business tax, which is what the Democrat plan would do. insert competition, across state competition. Get busy with liability reform. Make certain that you're attacking defensive medicine, which is where much of the cost is. There are ways to do this with simple 1- and 2-page bills. You do not need 3,400 new federal mandates, 53 new bureaucracies, 2,000 pages of a tome of a bill to do this. This is a tax bill. It is not a health reform bill. It is a tax bill, and it is going to drive up the cost of health care, and it is going, unfortunately, to attack our seniors in the health care
Mr. Scott,
that they have paid for in
literally only have
Medicare.
10 more seconds, Mr. Scott. Go ahead, give it a wrap.
10 more seconds, but what my good friend from Tennessee is saying is absolutely not true. This is going to help seniors. It's going to close the donut hole. It's going to repeal
Medicare is a trust fund, not a slush fund, and that's one thing that they don't understand.
That applies to these insurers. That will help with the Medicaid. We will stop insurers from price fixing, from having monopolies in territories.
If these guys think there is fraud and abuse in Medicare, they should have been addressing that all along.
I would say that's the last word, but those are the last words, plural.
Folks, we would love to bring you back. David Scott, Marsha Blackburn, thank you very much for joining us.
We will, absolutely.
Appreciate it.